Okay, now let's move to the fourth organ in our involuntary organs and see how sympathetic and parasympathetic affect that organ. Okay, so we have our GIT. Okay, and there is something important we have to know about GIT and urinary bladder. There is two types of muscles or smooth muscles. Again, smooth muscles is involuntary muscles, and that is opposite to the skeletal muscles, which is voluntary and is supplied or controlled by the somatic nerves. Okay, the smooth muscles in GIT and bladder has two types. First one is the walls. So we have the walls of GIT or the walls of the bladder around the bladder. Okay, and we have circular muscles at the end of this passage. These circular muscles are called the sphincters, and sphincters contract and relax. They are contract to resist the passage through the GIT or through the urinary bladder. Okay, and they are relaxed. They allow the passage of the contents of the GIT and bladder. Okay, so we have wall and we have sphincter. So in the GIT, for example, if the sphincters are constricted, so the content of the GIT is not allowed to pass. Okay, so we wouldn't be able to defecate easily. Okay, and for the urinary bladders, the same applies. Okay, so if we have contraction of the sphincters, we are not defecating easily, and the opposite, if we relaxed the sphincters, we would allow the food or the contents of the GIT to pass through and we would defecate. Okay, so contraction of the sphincters would not allow defecation to occur. And what if we need to defecate? We would relax the sphincters, and what we would do to the walls, we would contract the walls. Contraction of the walls applies pressure, so the contents of GIT are allowed to pass. Okay, now sympathetic is predominant in fights. Okay, so we are now in a fight. Do you want to stop the fight to defecate? For sure, no. So sympathetic nervous system decreases defecation, and it does that through relaxation of the wall and contraction of the sphincters. Your sphincters, the circular muscles, are contracted. The contents are not allowed to pass, and wall is relaxed. There is no pressure on the contents to pass. So there is a relaxation of the wall and there is contraction of the sphincters. So there is less defecation. Okay. For the parasympathetic, we have exactly the opposite. We have contraction of wall, we have relaxation of sphincters, we have more defecation. This is the system of rest and digest. Okay, so there is more action in GIT and parasympathetic nervous system. Okay, and we have no exceptions to say here. Okay, now let's discuss the urinary bladder, and the same almost applies to the urinary bladder as we learned. So in a fight, you don't need to stop the fight to urinate. So sympathetic nervous system relax the wall of urinary bladder and contract the sphincters of urinary bladder, so there is less urination. And the opposite with the parasympathetic, which contracts the wall and relaxes the sphincters, so it increases urination. Okay, now let's discuss the eye. Eye is very important organ, involuntary organ, which we would discuss a lot about it, because we have many drugs that affect the eye, and we have diseases in eyes that we will discuss in details later on. So eye is very important to understand. Okay, now we are going to discuss some simple things about eye for now. We have here this colored thing is called the iris, and this part through which the light passes is called the pupil. Okay, so we are going now to draw this iris, and in the center there is our pupil. Okay, and around this pupil there is two types of smooth muscles that are involuntary muscles. Okay, there is a circular muscle around the pupil, and there are radial muscles around it. So around the pupil there are two types of muscles. Number one, there are circular muscles, and number two, there is radial muscles. We can see here in green. Okay, so as a general rule, any muscles when any muscle when it's contracted, it gets shortened. Okay, again, when any muscle that gets contracted, it gets shortened. Okay, so these muscles which are circular, when contracted, they would shorten. Okay, so when if these circular muscles would make this pupil, if they become shorter, they would, again, this pupil would be narrower or smaller, because the muscles around it became or contracted and became shorter. Okay, so they become more near to the pupil, so there is narrowing, or the pupil became smaller. Okay, and on the other side, these radial muscles, when contracted, they would shorten. So we would find that, and they are holding the pupil. Okay, they are holding the pupil. So if they became short or shorter, they would go that way, and here would go that way, and go that way, and go that way, go that way, and they are holding the pupil, so the pupil would become larger. Okay, so the contraction of the circular muscles would cause the pupil to become narrower or smaller, and contraction of these radial muscles would cause it to be more or larger. Okay, so now, what are these muscles? These radial muscles are called dilator pupillae muscles, and these circular muscles are called constrictor pupillae muscle. So these dilator pupillae muscle, if they are contracted, they would become shorter, and so they would increase the diameter of the pupil, and we call that mydriasis. Okay, so sympathetic nervous system causes mydriasis to allow more light to enter. You're in a fight. You need more light to reach the retina of your eye. Okay, so there is a mydriasis. There is enlargement in the size or the diameter of the pupil. Okay, so the contraction of these radial muscles, which are called dilator pupillae muscles, causes mydriasis, and they are called dilator pupillae muscle because these muscles dilate the pupil. And on the other side, parasympathetic causes contraction of constrictor pupillae muscles, so they are shorter, and there is a constriction, or there is decrease in the diameter of the pupil, and we call that meiosis. So sympathetic causes mydriasis and parasympathetic causes meiosis. Okay? A very important exception here that we need to know that there is no parasympathetic innervation to dilate your pupillary muscle, and there is no sympathetic innervation to constrict your pupillary muscle. So dilator pupillary muscle has only sympathetic innervation, and constrictor pupillary muscle has only parasympathetic innervation. Okay, so let's again say that the ventricles of the heart has only sympathetic innervation. Okay, the blood vessels has only sympathetic innervation. Okay, there is no sympathetic innervation to the bronchi, and the dilatation occurs through the circulating adrenaline. And for the constrictor pupillary muscle, no sympathetic innervation, and there is no parasympathetic innervation to dilator pupillary muscle.